Definition: an altered state in which people become relatively unaware of external stimulation is defined as sleep. Reason for sleep: evolutionary theory, it vouches for protective function. Recuperative theory conserves energy, restores body tissues depleted during daily activity. REM: hormones released that influence thinking and memory formation, mental organization, counteract fatigue, irritability, and inattention. NERM: body replenishes itself, tissue restoration, and release of growth hormone. Sleep pattern. This is age and condition and sleep needs. Newborns need 12 to 18 hours of sleep. Infants to 14 to 15 hours. जिसमें से 50% should be REM or rapid eye movement. Toddlers 12 to 14 hours. Preschoolers 11 to 13 hours. School age children 10 to 11 hours. Adolescents 8.5 to 9.25 hours, out of which 25 to 30% of sleep should be REM sleep. Adults 7 to 9 hours of sleep, 20% or less REM. Moving on to stages of sleep. 2 stages: REM and NREM, rapid eye movement and non-rapid eye movement. People begin the sleep cycle with a period of non-REM sleep followed by a very short period of REM sleep. Dreams generally occur in the REM stage of sleep. Keep this in mind. REM sleep. Usually REM sleep occurs 90 minutes after sleep onset. The first period of REM typically lasts 10 minutes, with each recurring REM stage lengthening, and the final one may last up to an hour. Intense dreaming occurs during REM sleep as a result of heightened brain activity, but paralysis occurs simultaneously in the major voluntary muscle groups. The percentage of REM sleep is highest during infancy and early childhood. During adolescence and young adulthood, the percentage of REM sleep declines. Non-REM sleep. The period of NREM sleep is made up of stages 1 to 3. Each stage can last from 5 to 15 minutes. Starting with the first stage, which is the awake state, shows a reduction in activity between wakefulness and stage 1 sleep. The eyes are closed during stage 1 sleep. One can be awakened without difficulty. However, if aroused from this stage of sleep, a person may feel as if he or she has not slept. Stage 1 may last for about 5 to 10 minutes. Many may notice the feeling of falling during this stage of sleep, which may cause a sudden muscle contraction. Stage 2. Sleep spindles and K complexes ranging from 12 to 14 Hz. Spontaneous periods of muscle tone mixed with periods of muscle relaxation. The heart rate slows and the body temperature decreases. At this point, the body prepares to enter deep sleep. This stage occupies 45 to 55% of total sleep in adults. Moving on to stage 3, which is deep sleep. Deep sleep stages are known as slow wave or delta sleep. If aroused from sleep during these stages, a person may feel disoriented for a few minutes. During the deep stages of NREM sleep, the body repairs and regenerates tissues, builds bone and muscle, and appears to strengthen the immune system. NREM stage decreases as age progresses. Sleep pattern. Sleep proceeds in cycles of REM and NREM, usually 4 or 5 of them per night. Order is NREM 1, NREM 2, NREM 3, NREM 2 and REM. And this is that flow chart. Here time is shown and here the stages of sleep are shown. There is greater amount of deep sleep, stage N3 earlier in the night, while the proportion of REM sleep increases in the 2 cycles just before natural awakening. Physiological changes during sleep. This is a table, a comparative table, which shows physiological process during NREM and REM. First is brain activity. NREM decreases from wakefulness, and during REM increases in motor and sensory areas, while other areas are similar to NREM. Heart rate slows from wakefulness, and in REM increases and varies compared with NREM. Blood pressure, it decreases from wakefulness, while in REM it increases up to 30%. Blood flow to brain, during NREM it does not change from wakefulness in most regions, whereas in REM it increases by 50 to 200%. Respiration in decreases from wakefulness and increases but varies from NREM, but may show brief stoppages. Coughing suppressed. Body temperature is regulated at lower set point than wakefulness. Shivering initiated at lower temperature than during wakefulness. Whereas in REM it is not regulated, no shivering or sweating. Temperature drift towards that of the local environment. Sexual arousal occurs infrequently, and while in REM it increases in both males and females. Now, benefits of proper sleep. Memory processing, the body repairs and regenerates tissues, builds bone and muscle, and appears to strengthen the immune system. Wound healing. Diseases due to less sleep, impaired memory and thought process, depression, decreased immune response, and fatigue. Increased pain, stress related disorders, gastric ulcer, hypertension, cardiac diseases, and diabetes. Sleep inducing diet, bananas, grapefruit, figs, dates, yogurt, milk and milk products, etc. Foods to avoid: coffee, tea, spicy foods, chocolate, all alcohol, refined carbohydrates, additive, preservatives, non-organic foods containing pesticides, canned foods or any source of toxicity or heavy metals, cigarettes and tobacco.